Hi, I'm Dr. Nikhil. In this video, we are going to talk about Baker cyst, or also known as popliteal cyst. We at Medfin help find the answers to all your questions in much easier and simpler way. A popliteal or a Baker cyst is a fluid-filled swelling that occurs at the back of your knee. It causes tightness and reduced movement in your knee. The cyst may cause pain when you try to bend or extend the knee. Symptoms of Baker cyst. The symptoms include knee pain, inability to flex the knee, and stiffness in the knee. The symptoms can be worst after you have been active or if you have been standing for a long time. What are the causes of this type of cyst? Some of the most common causes of Baker cyst are knee arthritis, rheumatoid arthritis, damage to the knee cartilage, joint inflammation. The cyst is caused when too much of lubricating synovial fluid produced by the knee results in building up of the fluid in the back of the knee. So, how to diagnose and treat a Baker cyst? A Baker cyst can be diagnosed with simple physical examination or with an ultrasound, X-ray, and most commonly MRI is used for the proper diagnosis. It is treated using medications, fine needle aspiration, or a physical therapy. The doctor may inject some medication into the knee to reduce the inflammation. This method relieves pain but not necessarily prevent cyst recurring. In the needle aspiration technique, the doctor may drain the fluid from the knee joint with the needle under the ultrasound guidance. Lastly, physical therapy involves using icing, a compression wrap, and crutches for reducing pain and swelling. Gentle range of motion along with strengthening exercises of muscle around the knee may also reduce symptoms and preserve knee function. If possible, doctors treat the underlying cause of the cyst. If it's a cartilage tear causing fluid overproduction, he or she may recommend surgery to remove or repair the torn cartilage. Baker cyst associated with osteoarthritis generally get better with arthritis treatment and surgery is rarely required. Rest, ice, compression, elevation, reduction in physical activity, and pain medications can help remedies when the cyst is due to arthritis. Finally, which doctor should I contact for Baker cyst? A general surgeon should be contacted for a Baker cyst. However, an orthopedic surgeon may also be required for the respective treatment. If you are looking for one, do contact Medfin. To get an appointment booked with the best surgeon or an orthopedic surgeon in your city, we make sure that you get everything from the best facility to the best surgical experience here at Medfin. You can watch our other videos to know all about remaining cyst types. Links to the same are available in the description below.